Hey everyone, it's Dr. G. Welcome to Discussions with Dr. G. Now, if you clicked on this episode, you probably saw CAM or CAM in the title and thought, great, is this going to be about more stuff that I have to remember? Well, I promise it is relevant and honestly unavoidable. Over a third of Americans are using some form of complementary or alternative medicine, CAM. And many of those folks, they're showing up in our clinics, on our floors, in our ICUs, blending herbal teas with their warfarin, or side hustling some CBD alongside their prescription antidepressants. CAM isn't fringe anymore. That lovely patient with 4 med lists is just as likely to be using ginger capsules or essential oils as anything you'll pull from the Pyxis. And here's where it gets dicey. Many CAM products, especially these supplements and herbs, can seriously mess with drug metabolism. I'll never forget this patient I had back in med-surg. Sweet lady, always sipped natural herbal teas. But after a week of these mystery plants, her digoxin level sailed up and she started seeing halos around lights. Classic sign of toxicity. Whole team ended up in a huddle. What did we miss? Turned out those harmless teas were anything but. Full disclosure became the new theme on our unit after that mess. You get the picture. Safety's on us, and if we don't ask, patients usually won't tell. So let's clear up the alphabet soup. Complementary, alternative, and integrative. It's not just word salad for Jeopardy categories. So, what is complementary medicine? That's when patients use CAM alongside their regular treatments, like acupuncture with chemo to help curb the nausea. Alternative, that's when they say, I'm going with herbal tea instead of antibiotics. I know, not the greatest idea, but it's up to them. Now, integrative medicine is what everyone's aiming for. Mixing what works from both worlds, coordinating across the healthcare team, customized for the patient. But make no mistake, the stakes are high. If someone skips antibiotics for E. coli and picks green tea, well, you can guess how that's going to pan out. At the heart of it, you've got conventional Western medicine, which is all about evidence, diagnostics, and high-tech wizardry, versus CAM, which takes this whole person, let's balance your energy and support your wellness approach. Sometimes those paths complement each other, and sometimes they clash. But as nurses, it's our job to know which is which and how they fit together safely for our patients. CAM isn't just a bunch of random teas and crystal therapy, okay? There's a whole taxonomy. You've got mind-body practices like meditation and yoga, biologically based stuff like herbs and oils, body-based approaches like massage and chiropractic, energy therapies, think Reiki or therapeutic touch, and even full-on traditional systems like Ayurveda or traditional Chinese medicine. There's a reason I always ask about everything from fish oil to reflexology during my med rec. Nurses need a high CAM radar for 3 big reasons: stress reduction, symptom management, and the big one, risky interactions. I learned this the hard way, again, with a patient on SSRIs who was also popping St. John's wort like candy. If you don't know, that combo can send serotonin levels off the chart. You really can't just say, any new meds? What I say is, what teas, oils, powders, or out there stuff do you use for stress, pain, or sleep? You'll be amazed at what comes out if you ask the right way. Sometimes they almost whisper it like it's a confession, but that's your opening to keep everyone safe. Now, let's talk ugly truths about herbal products and supplements. Unlike your trusty pharmacy medication barcodes, these things are basically the Wild West. Minimal regulation, quality all over the place, dosing that changes batch by batch, and don't even get me started on undisclosed contaminants. The highest risk, folks, patients on drugs like digoxin, warfarin, cyclosporin. Those meds where even a tiny blood level swing can be a disaster. Even more so for perioperative patients, that sleepy calming supplement can spike bleeding risk or mess with anesthesia. And a special shout out to my pregnant, breastfeeding, and pediatric friends. Most supplements have so little safety data for these groups, it makes me sweat just thinking about it. I had a postpartum mom once, started bleeding out after mixing some traditional healing teas with her regular meds. We had to jump into teaching mode and review everything she was taking, call the provider, and keep watching her labs. The core safety message is there's no such thing as a harmless supplement. We have to champion real teaching so our clients don't unknowingly walk right into these traps. So, how do we help clients navigate this minefield without turning into the med police, or worse, coming off like we don't respect their beliefs? Start with open, curious interviewing. Don't assume, don't roll your eyes, and don't cut folks off mid-story. You want the full rundown. What do you think caused this? Why now? What has your illness done to you? What's worse about it? And what are you hoping for? It's all about pulling out their health beliefs without judgment. My personal style is to ask about everything and let them teach you. Then you can teach right back. Urge them to run all supplements past providers, stick with high quality brands, don't double dose, more is not better, and report weird symptoms immediately. Teach patients especially to disclose everything before surgery and to be extra cautious during pregnancy and especially with children. Using Teach Back, can you explain back to me what to watch for with this supplement to ensure that it sticks? Bottom line, our job is to honor what matters to our clients while steering clear of disasters. That's the real art of nursing. I'll be back next time to dig even deeper, so take care and never ever skip the supplement questions.